In tonight's Health Watch, when it comes to blood pressure, it seems lower is better. We're talking even lower than current recommendations. New details released today from a landmark study could lead to changes in blood pressure guidelines. CBS 4 health specialist Kathy Walsh joins us now. And Kathy, this was a really big study.
10,000 patients, Karen. That's a lot of patients, and the largest study yet to compare blood pressure levels. It shows how crucial lowering blood pressure is in reducing heart attacks and death. You'd never guess Mary Jepsky was once near death with complications from high blood pressure.
I am now at 69, much healthier than I was in my 40s.
Hello. Thanks to medication and lifestyle changes, she's reduced her blood pressure significantly. Now, a landmark study from the National Institutes of Health shows clear benefits to reducing blood pressure below 120 for patients over 50 at risk for heart disease.
With this lower blood pressure, there was about a 35% relative risk reduction of cardiovascular disease, and that's tremendous.
The study also found a 43% reduction in heart-related deaths. In fact, the results were so encouraging, researchers stopped the trial early. Currently, guidelines recommend patients keep the top blood pressure number under 140. Doctors say these findings may change that.
We really need to be more aggressive about getting the blood pressure down, and this study is showing us how important it is.
Mary says with her blood pressure now at 119, she has more energy.
I go to the gym, I take yoga classes, I walk an hour a day, 7 days a week.
And she volunteers to help educate others. Now, the study did find a 1 to 2% higher rate of adverse effects from lower blood pressure, such as fainting and kidney failures. Very small. And yet, falls due to lightheadedness were not more common.
So many complications from high blood pressure. Got to get it down.
But I like that. You know, they're seeing that it really will help if you get it even lower.
That's great. Thanks, Kathy.
Okay. Remind me of your name.
My name is Shireen.
Shireen, okay.
Yeah.
You're just coming from a pharmacy where they offer a service of checking your high blood pressure, right?
Right.
And your pressure was?
144 over 89.
Before you went? When you came?
Before I went, it was 184.
184, well, that's the top number, right?
Right.
Okay, all right. When you went to the pharmacy and you did the first pressure check, what was the reading?
144 over 89.
144 over 89,
right.
Okay. And then I actually applied Capinal, you applied Capinal
right.
to the area where
heart.
Okay. And you went back for another pressure check approximately 5 minutes after.
Right.
What was the reading then?
Oh, it was awesome. 110 over 70. I was so surprised.
110 over 70?
Yeah.
And you were surprised. And the person who checked the pressure, she also was surprised.
Surprised. She was like, oh.
She couldn't believe that you came back in 5 minutes.
Couldn't believe 5 minutes time.
Yes.
And I myself couldn't believe because I started to begin to feel lighter.
Yes.
You know, my head that was so heavy, it feels like I want to fly.
You feel like you want to fly about
I just feel different inside. It's like I'm on top of the world.
And you got excited.
Yeah, I got so excited. I just couldn't believe.
With appreciation, really.
With appreciation.
Appreciation.
You know, God Himself.
God Himself, was able to help you, right?
Yeah.
So, okay. But you have had an experience. You have had maybe several experiences before with the product Capinal. Yeah. Tell me, what are some of the experiences that you have had?
I had this problem, this foot problem on my ulcer foot right here.
Right there.
Right. On the ankle.
Yes. You had an ulcer there.
Right. And I went to I went to clinics. I went to private doctors. They gave me antibiotics. They even prescribed Dafalan for me for on monthly supplies. Like every month
every
I'm
month,
supposed to be on Dafalan 500 milligram and a lot of ointments. I put there. I put ABM. I do a lot of things.
A lot of things, yeah.
And it couldn't.
You didn't get any good result at all?
No, it just eased for 2 seconds and then it come back to square one.
So when did you start to get results?
It's when I found this nice gentleman. Someone who knows this man who knows the right healing stuff.
Okay,
to heal my foot.
You found a friend, and that friend told you about me.
A friend told me about this gentleman, and even when I just got the medicine, I was saying that I don't believe in this medicine because I don't want to take it.
Okay.
I had it there, and I said, I keep on doing my original, taking my pills and rubbing ointments in it, and I said, no. And I lie down there one day, and I said, the spirit keep telling me, go and touch that medicine. Might be it, I got heal your foot.
Yes.
And I said, I ignore the spirit. And then I started to ask people all over the church, ask people, what do you think about this medicine? You ever heard about it? And I asked somebody, and then some person one was a herbal doctor one day, and they looked it up and said, yes, it is a good stuff. And I said, what? And I said, all right, I'm going to try it. The first time I tip a little in it burns me. I start to scream out the whole house. I scream. I bawl. And I remember when I said to you, I call you on the phone the day of the number of the bottle. Okay. And I call you and you said, apply more to it. And the more I apply to it, the lesser the pain gets. Okay. And I applied to it, and I don't use that medicine for 2 weeks. And that was an awesome help for me.
So you only use it for about 2 weeks, and what happened after 2 weeks?
The foot, it was a big hole in the foot. You could look down in it. Yes. And the foot just
and also you had there for some time.
Yeah, even some doctors came right at the clinic down there and saw my foot. They asked me, what have I done to this foot? They have never seen nobody foot look like this, and they are doctors from England. Okay. Some doctors come from the church down there. Yes. And they said they have never seen. Even the lady that over there just died the other day, they said that lady, my foot is 100%. They asked me, what have I done to this foot? I honestly never tell them, but I said to them, I clean it properly. Okay. And I started to watch it to see, because it was right in that same time I was using the medicine. Right, yeah. I couldn't really tell them everything, but gradually, they said, whatever I'm doing, I must keep it up. The foot look awesome.
And after it does disappear, the ulcer?
It disappears. I mean, when cold times come, I could feel my foot biting. I feel nothing. Sometimes I forgot about that foot was ever sick in my life.
You don't remember that your foot?
I don't even remember right now that foot was ever sick. That's how much I am feeling right now.
I'm telling you.
Give God.
God is good. A big hole in the foot, and you just showed me a while ago. And I mean, let me look at it again.
See there?
Okay, from a big hole in the foot to totally healed. Not even a scab is there. Totally healed. Totally healed. Walking, transform.
Totally transform.
Totally transform. That is good. Totally. And the little darkness on it, if you put Capinal, that will soon disappear.
Yeah, I was doing it because it was darker than that. And by putting Capinal, at the same time, it just get lighter.
It's going to get lighter, back to normal color. Yes, so it was good.
It's awesome.
What else apart from the foot problem, the ulcer? Any other problem you had? You can recall using it for?
Yeah, I went to the doctor the other day, and the doctor was telling me that I had a little burn right here, and a little pain right here. And they were saying they don't know, but they would give me paper to do ultrasound to find out if I had a gallstone. Okay. And after I had some I was saying it back to the person, and they recommend the same Capinal.
That is Mr. Ivy.
Mr. Ivy. And I was saying that Capinal, that's the same Capinal I get for my foot. What I'm going to use Capinal here for? Yes. The person said, just rub it to the heart. Yes. And I rub it to the heart. And trust me, the burning disappeared. I was telling the doctor said, you're too light.
Oh, you're telling me you're too light?
I can't believe.
Can't believe.
They don't rub it here. I don't feel it.
Yes.
Just gone.
Just disappear.
Even the puffiness I can press.
You can press?
I couldn't press.
You couldn't press your stomach before?
I can press now.
You can press now.
Press.
And that puffiness and all of that disappear.
It's gone.
Gone.
It's like it detox me.
Yes.
It's like it detox me.
You feel light, you feel energetic, you feel much better. And you know, and I like your spirit because you're giving God the glory.
Yeah.
You know. And I was saying,
just want to recommend it out there to people.
Right.
Because you won't regret it.
No, I know I'm glad because I tell you the truth, gratitude is a medicine. And you see, right now you're healing even further, you know. You know why? Because you're giving me a testimony, an honest testimony in a delighted way. I can see the emotion in your face when you're talking because of the memory, when you remember what you were going through.
Yeah.
Yes.
I remember I wanted to come out of the bed and I just can't come out of the bed. I have to be like, I remember I couldn't go to the bathroom. I had to keep a pail at my bedside.
A pail at the bedside. You couldn't go to the bathroom.
Because I couldn't move. I have to be tipping, hopping because of the ulcer.
Because of the ulcer in your foot.
I have to use the pail. I would be like I had my room. I was like I was in a hospital. Hospital,
yes.
And I'm telling you.
But what happened is that you were in your room. It wasn't an hospital, but you were in your room. But you had a doctor in the room.
Yeah.
In the name of Capinal.
Right.
And Capinal really restore you back to happiness, to laughter.
I just keep on telling it to people.
Yes.
You know, they be like, what? Sunday gonna tell somebody, and they say that, for real? You need to give me that number.
Yeah.
Call.